Today, we are privileged to have Dr. Milton Amayun speaking on the subject of serving the urban poor. Milton earned his MD from the University of Philippines and a Master of Public Health from Harvard University. At 1970, the World Congress of the then ICMDA, which was called International Congress of Christian Physicians, he met his wife, Dr. Rhea Ebling from Helsinki, Finland. They were married in Bangkok, Thailand in 82, and then served in Thailand, Costa Rica, Cambodia, Eritrea, Ethiopia, Senegal, the United States, Eastern Europe, Benin, and now in the Philippines. Dr. Rhea went home to the Lord in September 2020 after a 2-year long illness while they were stationed in Manila. Since then, Milton's involvement with poverty and issues have further intensified. He is currently the president of Uchengo Center, a think tank on poverty. He chairs and sits on the board of several uh, civil society organizations. He teaches leadership and development themes in a private university. He also leads a home church once a week. The theme he will be addressing is serving the urban poor. As you know, the majority of the world population now lives in cities. The concentration of people in urban centers will intensify in the upcoming years. Many cities with populations of 1 million or more are added to the already long list each year. Organization requires investments in infrastructure, jobs, education, and social services. The lack of regional urban planning has led to increasing problems of homelessness, unemployment, pollution, lack of water and sanitation, crime, substance abuse, juvenile delinquency, prostitution, trafficking, and other many illegal behaviors. It's a mission field with multiple challenges. Yet it is in the cities where God's message of redemption is most needed and where Christian serving with love can make a great impact. This webinar examines some crucial opportunities for Christian service in this vast mission field, where the gospel can transform the quality of life of children, youth, adults, families, and communities around the globe. So, welcome once again, and over to you, Dr. Milton, to start your sharing your thoughts.
Good evening, everyone. It's a pleasure to greet you from Manila. And I would like to thank ICMDA for allowing me to speak about the work that we do regarding the urban poor in the Philippines. I would like to thank also Dr. Peter Sanders for thinking of me. And we plan to have this webinar way back. Um, and so let me begin by saying that urbanization is both a blessing and a curse. In Manila, you can see this photograph from many directions and from many locations in the big city of metropolitan Manila and in the other smaller cities like Cebu, in the Visayas, Davao, in Mindanao, and even in the smaller, even smaller cities like Iloilo or Bacolod. The term urban poor is actually a sanitized name, which many of us know better in our local languages. Uh, People talk about the urban poor as slum communities. In Brazil, they call them favelas. In other parts of Latin America, they call them pueblos jóvenes. In the Philippines, we are more direct. We just say squatters or barong-barong, barong-barong. And the numbers are quite uh, significant. 80% of the 1.1 billion estimated slum dwellers are in Africa, Central and South Asia, but another 20% are in other regions like Asia, Southeast Asia, and Latin America. The reason why I call urban settings as uh, both a blessing and a curse is that they are where jobs and opportunities for creating wealth abound. But there are also places where millions endure miserable lives due to poverty, malnutrition, violence, and illegal activities. As you can see in the picture, many of these families living in these structures at the foreground of the photo are in situations where no human being should live. Now, the proportion of the urban population living in slums declined actually between 20, 2000 and 2014 by about 5%. But that positive trend reversed course in 2018 and started going up. And as you all know, many people became poorer during the pandemic, so that number, we don't have those numbers yet, but for sure, the numbers are much higher now than in 2018. Now, the decline between 2014 and 2018 was actually not that bad, but the pandemic exacerbated it to the point that it, in many places, the number of people living in slum areas could have doubled. In the Philippines, for example, some cities in the Philippines, 4 in 10 Filipino households belong to an informal settlement or to a slum community. And once you become poorer and your housing becomes substandard, it's very difficult to get out of it because housing, modern housing in the Philippines costs a lot of money. And I'm sure it's the same thing in other parts of the globe. There are a myriad issues in an urban slum. And I'm showing only a few here in this slide. You can see the houses that are next to each other, and many of those houses do not have indoor plumbing. They don't have proper toilets. Then you will see drainage and where uh, dirty water accumulates, no infrastructure. Then the garbage. They become centers of scavenging. You can see here the two children who live on what they can gather from the garbage that has been thrown by other people. Then you have substance abuse. There's a lot of drugs being sold and consumed in these communities. And then there is really no assured source of clean water. And then, of course, there's the violence, there's the illegal activities happening all around these slum communities. Yet, in spite of all these difficulties in informal settlements, the church can thrive in the midst of all this suffering. In fact, in the Philippines, you cannot go more than 500 meters without seeing a small church, a lean-to where worshipers gather every Sunday, and there are makeshift preaching points. The growth of the church in the Philippines was actually in the slum communities during the 90s to the year 2000. And I used to work for an organization called International Care Ministries. And the backbone of the work that we did in ICM was through the network of these churches. And I would say about 70 to 80% of these churches were in urban slums. Okay. I would like to talk a little bit about Kids Island Philippines, the organization that I helped start together with my wife. Actually, Roy Kapati was the precursor of the work of Kids Island Philippines. And he was a colleague in a Christian organization. And at the beginning of the COVID pandemic, in his hometown of San Fernando, Pampanga, a city 90 minutes north of Manila, he began responding to the needs in his community with an initial investment of $10 from his own pocket. Pampanga is not far from Manila. In fact, it is the center of culinary expertise for Filipinos. They are known for many of the dishes that they uh, provide to other regions of the Philippines. So a lot of people actually are quite wealthy in Pampanga, and San Fernando is becoming a center of development uh, in that part of Luzon. Now, Raya and I visited um, Roy in Pampanga. Actually, Raya was already beginning to have signs and symptoms of her illness at the time. But when we saw the need, we committed to help Roy get support for Kids Island Philippines. We had experience working in poor communities of Cambodia, Thailand, and Senegal with World Vision International, with USAID in Benin in West Africa, with International Aid, another Christian agency in Honduras and Kosovo, and with International Care Ministries in the southern islands of the Philippines. Uh, my wife initially was the medical director, and I was president of the organization. Now, Kids Island was started during the pandemic, and San Fernando has a population, according to the 2020 census, of 354,000 people. The poor communities of San Fernando actually are people who relocate to the city, but they don't have jobs there and they don't have savings to spend for their daily expenses. So they become informal settlers at the fringes of the city's territory, and they survive on scavenging and selling small things in the market. So this is a precarious existence day to day before they get integrated into the roles of the city's social service delivery system. And here are photos of what it looked like in the beginning of Kids Island, Philippines. Makeshift dwellings, children not being provided the space within which they could play, houses beside a river that would get flooded every time it rained. And some of those dwellings would be destroyed every time there is a typhoon that visits the Philippines. And on average, there would be at least 10 to 12 typhoons during the year that would be destructive enough to destroy some of those dwellings. Then COVID-19 came and people could not go out to find a living. And here are some of the things that happened. You can see here a crib next to an animal's house, and children not being able to go beyond what uh, housing they have. And you can see that the housing that they have actually is on top of the water. And sometimes illness would exhaust whatever resources a family would have. And this 5-year-old girl on the right was a COVID-19 patient, which Roy from Kids Island Philippines had to help and encourage and visited in the hospital for 2 weeks before she could recover and go home. Now, Kids Island Philippines wants to do a biblical approach in serving the poor. Remember what Jesus said, I have come that they might have life and that they might have it more abundantly. That's in John 10:10. So, Kids Island Philippines, our mission is to create islands of hope for children. Our motivating principle is that as Christians, we know the love of Jesus and we are constrained to share his love in spite of all the problems like teenage pregnancy, juvenile delinquency, out of school youth, drug abuse, children in the streets, child labor, dysfunctional families. These are all the problems that have to be addressed when you are in an informal settlement. And I would say that they are not simple and they are interconnected so that you may have an answer to one, then you find out that there's another one behind it. And if you find a solution to that other problem, there's something behind it. There needs to be a total and comprehensive approach to human nature and culture because as a nation, the Philippines has been colonized by several colonial powers, including Spain, the United States, and Japan, and even briefly the British occupied the Philippines way back. So we need to address the culture, the traditions, the history that has prevented us from charting our own way out of poverty. And we need to advocate for those principles that could help people come out of their poverty. S- So I would like to emphasize again the principles that we want to practice in Kids Island Philippines is that we would like to create islands of hope for children because Jesus said, I have come that they might have life and that they might have it more abundantly. And he was certainly speaking of the children and he was also speaking of the families that they belong to. I would like to discuss a little bit our vision. And the vision is a transformational journey of children and their families to faith and prosperity being enabled. And like I mentioned earlier, it's not an easy process, it's quite complicated, but it begins with small steps like building trust and relationships with the children and their parents and the families that they belong to. Then we will like to have those parents become engaged. They get more interested in helping their children get fed. We ask them to volunteer in the cooking, preparing of the food, in the uh, serving the children with the food, cleaning up. So the parents themselves are active, engaged participants in the welfare of their children, while before many of them would be uh, disengaged, would not even be interested. So we want them to be part of the process of transformation. And we collaborate with the church, the school, the community, and the authorities, the political authorities. Our common goal is to fulfill the mandate to have an impactful life for the children. And the top five benefits that we target at Kids Island Philippines are health and nutrition, their elementary education, faith and values formation, and their development to become productive adults. So, in summary, we are reducing the vulnerability of the children as they grow into becoming adults. Now, here are some photos of what we do. Um, Feeding is very important. Uh, Children are hungry; they need to be fed because uh, they are growing, and we know that there is a crisis of malnutrition in the Philippines right now. 2 days ago, I attended a conference where we were trying to see what could be done to reduce the triple burden of malnutrition in the Philippines. Children who come from poor communities are stunted and also wasted. Many of them go to bed hungry twice a week. While among the upper middle class and the upper class of Filipino society, the problem is obesity. So, both ends of the social spectrum, there are problems that are different. And then in the middle, the women of childbearing age are the ones who are anemic because when they bear children, they lose blood, and their iron deficiency anemia needs correction through proper diets and supplementation with minerals and vitamins. So we prioritize feeding. The nutrition of children, the brain of the child needs to be fed at a certain time. And if it is not fed exactly when it is growing, we miss the opportunity of creating adults who have the full capacity to think, to solve problems, and to create a society that will help them reach prosperity. Education and protection. Children need to be uh, allowed to be children without being abused, molested, or abandoned. And Kids Island Philippines, even in a very short time, has been dealing with several children. One of the things that we have done is to make sure that those who need to be in school are assisted to go to school. So we also partner with the school, and we also teach them how to be children, how to play, how to do drawings, and how to enjoy books, and how to enjoy playing with each other. There is that picture at the upper right hand corner where we also ask them to listen to the gospel message. And many of them learn for the first time how to pray, how to thank God for the food that they are about to receive, and to ask God to bless them and look after them and their parents, and to recognize that there is a creator watching over them. And our work is supported by the school on the right and the local church for the two other pictures. Uh, Bible Christian Church in San Fernando, Pampanga, the pastor is on our board, and the young people of the church assist Mr. Kapati in reaching the children, helping them listen to Bible stories, and helping them to be organized for readiness for school. So we thank the local church who has been very good in accommodating uh, us, in including us in their outreach to the community and in providing space for our meetings. Okay, what then is the result of the things that we do? Number one is hope. Children and their parents, sometimes life is so overwhelming. There are so many challenges in life. But they are reminded that there is hope when people recognize that they have problems and there are people who are willing to help them, people who are willing to listen to them. The picture in the middle is a house that Kids Island Philippines built for a family with several children who had actually nowhere to sleep in. And they had a house that had no walls on the right side. And we built that house in the middle. And the best result of all of this is that they had regained their hope, a positive outlook in life, and the ability to know that they have a place to go home to at night. Okay, what are the results of the work that we have done so far? Kids Island Philippines is only in its fourth year of operations, compared to 3 to 4 years of work. But already we are seeing young people getting involved, children getting protected, children who are unable to go to school are going to school, and children who are receiving meals where they used to go to bed hungry all the time. So there's a generational change. There is that small step in their journey out of poverty. So it's not all hunger every day, it's not all missing school every day. They feel that people care. They feel that there are some who would be willing to give them a meal so that they can go to bed with full stomachs. And of course, the church is also mobilized to assist. And the people of God know the Lord's love, and they are sharing it with the people who need to know Him. Okay, part of the result of that uh, journey is children feeling thankful. And we can see the letters being translated here. They're saying, "Thank you very much." The 8-year-old dreams to be a nurse, and he says, "We appreciate the feeding program. It helps us a lot. Please do not get tired of doing good and helping us." And for us, this is enough reward for the little that we do to raise the level of quality of their lives. And hopefully, these children, many of them, as they know more about God's love, they will become productive adults in society, rooted in the faith, and journeying out of poverty into prosperity. I would like to close by inviting you to connect with us if you need more information. Mr. Roy Kapati is the executive director, and the information is in there. We also have a Facebook page, uh, Kids Island Philippines. If you want to know more about the things that we do, there's a lot of information there as well. Thank you very much.
Thank you, Dr. Milton, for that excellent presentation and sharing of what you are doing in that part of the world. Um, we will have a time of question and answer now. Let me pull back a bit and ask a question about the magnitude. In our own region, South Asia, we heard is pre-COVID, there are almost 45% of the big cities were slum dwellers, if there is an alternative term for them. And then about 20% went back. And then most of them, or more than what who they were came back. So it is said that there is an increasing number than what was pre-COVID. Is that the scenery across the globe?
Yes, the phenomenon is actually increasing even though we are now coming out of the COVID pandemic. In some places, it's because uh, the construction of housing and infrastructure is not keeping up with the increase in population. So we are seeing numbers. The estimate is that there are at least 250,000 people being added to informal settlements every year. So across the globe, it's a growing problem. And all of us who see this could at least contribute a little bit to alleviate some of the suffering of these people who are in these informal settlements.
Hmm. Yeah, and then I think traditionally it has been a kind of unseen community, even by the planners or by missions many times, because our focus has been on the poor in the rural, and urban poor has been an unseen community. Shirley asked a question that the first step of your engagement was building trust. She's asking how do you do that? How do you create this?
Oh, actually, this is a very crucial initial step. Listening, hours of listening, simply sitting with them, telling them that you are their friend. Because if you don't do that, if you come in and parachute out, you will not be identified with them. And it will be very difficult to even do what you plan to do. They have to trust you first. And that trust can only be gained if you respect them as well by hearing them out, giving them your time, and giving them attention to make sure that they will start trusting you. Very important. Sometimes it takes months before a family would trust the volunteers. But fortunately, many of the volunteers belong to the same community, so there is already that first step of familiarity. But even then, you still have to gain their trust so that you can intervene with the problems within the family.
Thank you. I think that point of the people from the community itself being part of the volunteer team is very important to build that relationship. Uh, Dr. Elliot Lawson is asking, how is this program, Kids Island, financed?
Okay. Financing is always a problem for people who want to do this kind of work because it's almost like an unending need that you have to be responding to. Uh, so far, we have been assisted by an organization in Germany with the same name called Kids Island Germany. So they are helping us do the feeding, but we also raise funds from within the Philippines. We raise funds from the members of the board, from our friends, and the financing is not always with money. It could be supplies like notebooks, pencils, papers, and even food from local suppliers. We have to make those friendships also with the donors and supporters to make sure that the work on the other end of feeding, helping the children continues. Both pieces of the responsibility have to be given attention by the leadership of uh, the organization. Um, Mr. Kapati, for example, one of the things that we do at Yuchenko Center is to train people from civil society organizations like Kids Island Philippines on how to write proposals. So my other organization, we also support with training, capacity building, especially in fundraising.
So a lot of partnerships with various groups.
Yes.
Angel Wong from Burkina Faso has put some thoughts in the question answer. One of the key things she's saying is that in Burkina Faso, there's more than 2.6 million internally displaced persons as of March 2023. And they are moved to the capital city of capital city. And the whole challenge of relocation of health workers from some of these areas because of security challenges, because of it's an insecure place, so they moved out, and deportation of the population, and the whole challenge of this huge number coming in and very poor health infrastructure. So she ends with this question. So in light of your rich experience, please give some hopeful ideas to our organization of Christian physicians and medical students in Burkina Faso, how to reach out to them.
Okay, here is what I would advise you to do, Angela. Angel, sorry.
Thank you.
I would ask that you get trained in how to deal with public health problems. As doctors, that is your contribution to the whole gamut of help needed by these displaced persons. And by simply assuring that these public health problems are prevented, simple ones, at least from what I know about Burkina Faso, some of the things that would be needed there would be like maternal and child health services, prevention of common diseases like malaria, or vaccination against local diseases, especially the children. If you have people who are able to organize those kinds of services, I am sure UNICEF will love you. The Minister of Health of Burkina Faso will help you. Then the other piece that I would like to mention to you is that because you are professionals, you have something to offer to the people who are responding. Now, the number that you gave, 2.6 billion, already requires the attention of the UN. And whenever there is a number like this that's displaced, the World Food Program has to intervene with the food problems. So, as professionals, as Christian professionals, offer your organizations, offer your services to them, and they will recognize it because they will need it. The people from WFP probably don't know how to prepare the food that is consumed by the local population. Or you can even help in weighing the children to make sure that the children who need additional feeding will receive additional food from WFP, and that they would be given a therapeutic feeding if necessary. So, your professions as healthcare professionals, dentists, nutritionists, they are very important when you are confronted with problems like this. Personally, I've been there. I've been in the Cambodia crisis. I've assisted in different places where there have been refugees. The UN system appreciates the participation of local professionals, and it is your time to show that Christians care.
Thank you. Thank you. Elliot is asking, what is the best answer for appropriate housing? There are disadvantages to high density housing, then there are land limitations. Is there an answer for this?
Okay.
For an answer for appropriate housing.
Appropriate housing.
Housing.
In the Philippines, we have a group called Gawad Kalinga. They have some information and experience in how to do housing. And then, of course, Habitat for Humanity. My suggestion is that you would contact them and ask them if they would intervene in your community. They are the ones who are ready to give you their expertise and at the same time to help you build those housing. The two names, Habitat for Humanity, based in Americus, Georgia, they have a website. And Gawad Kalinga in the Philippines, they have built a lot of houses, low-cost houses in the Philippines that are appropriate and maintained by the persons who receive them.
Linda is asking, please describe the role of public health nurses and nursing students in promoting health of the urban poor.
Okay, there is something very nice about that question because it's not only the public health nurses who can help, it's also the students. Why don't you make the students use an informal settlement as the training ground for them? And for example, I'm also chair of the board of an organization called Nutrition Foundation of the Philippines. And one of the things that we do is we supervise the community health training of nutritionists and we assign them to a
Mm.
community. So I would suppose that nurses, if they want to have some kind of a public health nursing activity, they could be used by many of these communities that might need their expertise while they themselves are learning how community systems work. And um, we have a program in the Philippines called Doctors to the Barrios. Before the doctor gets
Mm.
licensed, uh, she or he would be assigned to a community and work with a local government unit. And the same model works for nurses, for nutritionists, medical technologists, and other health professionals.
Thank you. And Linda is also offering you partnerships from the UP College of Nursing in the clinical rotation of nursing students for Kids Islands. Maybe that is something you can talk to Linda one-to-one. Linda, you need to get in touch with Dr. Milton.
We already are, Santos.
Yeah. So I think. Uh, May, May is asking, do you train community members to serve as community health workers or follow the care groups model to reach community?
Okay, we are not that sophisticated yet because community health workers are actually at the uh, fringes of the health system. We do work with the education, Department of Education, because of the schools. But hopefully, eventually, when we get established, we will be working with uh, the health system as well. But at this point, we are not yet there, but we are planning to do so.
Okay. I think it's somebody from Maria from probably Philippines asking, is your coverage only in region 3, Central Luzon?
Yes, for now, Maria, we are a very small organization. We are only 3 to 4 years old. And at the moment, but you're welcome to visit Mr. Kapati in San Fernando if you are in Region 3. I don't know which region you are in, but you're welcome to visit.
Yeah. Elliot Lawson also saying that in the US, it is controversial to get government funding for this kind of programs. Is Kids Island open to receiving government financing?
Absolutely. We are ready to write proposals to anyone who would welcome a proposal. And that's our expertise at Yuchenko Center. And Kids Island Philippines
Mm.
is one of the organizations that we have committed to mentor over the next 3 years so that their funding
Okay.
becomes more established, becomes more stable.
And Elliot Lawson is also offering that these programs can be written as a uh, uh, article to publish in the Christian Journal of Global Health, especially the nutritional and health aspects. Maybe Dr. Elliot can reach out. You can reach out to
Elliot,
Dr. Milton. Yeah, you know him.
I'm on your editorial board.
Yeah.
So expect a paper from me.
So one of the questions from Linda is, how can you compare the approaches used in West African countries to what you use in Philippines? in improving the social determinants of health in urban and rural poor?
Okay, I am familiar with the Philippine setting. I am less familiar, although I have lived in Africa for a long time. As I mentioned earlier, culture has to be addressed. There are very many elements in different cultures that sometimes people coming from the outside are not aware of. And so it needs people from within to be able to understand where to begin and where to make the biggest uh, intervention. I'll give you one example. When I was working in West Africa, uh, I was trying to introduce green leafy vegetables to eat because the diet was very much meat based. And so I said to my team, and this was even my team, this was a public health team vaccinating children in Senegal at the edge of the desert. And I said to them, I can make a salad of kamote tops, or uh, it's a vegetable that's very common in the Philippines, and it also grows in Senegal. And I said to them, I'll make a salad composed of the tops of this vegetable. And their first reaction was, "You are going to feed us horse food? That's food for the horses." And what I did was I had to cook for them, and I said, "Come taste it. It's not that bad." And so I invited them to
Hmm.
my house and made a good salad out of sweet potato leaves. And I don't know, but they told me that the taste was acceptable. The
Hmm.
tastes of local people in different parts of the globe sometimes are a very big obstacle to the improvement of the nutritional status of children.
So you need to have the local knowledge and expertise to create, those food and food items. Linda has one more question. Can lawyers and law students contribute to kids' islands and the urban and rural poor?
Linda, you're always welcome to contribute cash and financial support to Kids Island Philippines. But in a more practical term, I think um, young organizations that are like Kids Island Philippines need to be mentored as to how they could be um, registered with the system in the Philippines. It took us 2 years to get our registration with the Securities and Exchange Commission, the Bureau of Internal Revenue, and now we are working with our registration with the Department of Social Welfare and Development. So if there are lawyers who are willing to assist organizations get registered officially uh, within the system, the government system, that would be a well appreciated gesture.
How did you get this idea of islands of hope or a community of hope? How was that developed? I'm just
Actually, the Kids Island name was developed in Germany, and we adopted it because it rings a bell. Uh, Children should not be ignored or abandoned early in life. They need to have a good start in life. I remember the Nobel Prize winner poet Gabriela Mistral from Chile, and she said, "The name of the child is today. It cannot be postponed. The growth of the child cannot be postponed. The name of the child is today." And that is exactly what we are trying to do with Kids Island Philippines. They need to have a good start in life so that history doesn't repeat itself. So that when they grow up to become adults, they are productive, they are not in conflict with the law, and they are healthy, they are well um, they are reaching their full potential as creation of God.
Thank you. And I was kind of struck by what you said, and the children with obesity on one side, malnutrition on the other side, with the anemic mothers in the middle. That kind of communicate the unequal world we are in.
Yes.
Uh, uh, how easy or challenging was it to motivate the church to reach out? Because the answer is for the church to reach out. You said church is very active part of this whole moment. How easy or difficult was it?
Okay. The church is an instrument of God's love. Each of us on our board are members of churches that believe that Jesus is the Savior and that Jesus loves the children. We need to mobilize churches, wherever they may be, to shine by creating these islands of hope for children. And sometimes we have churches shining for the Lord, but there needs to be more and more of them, more and more of their members to be the hands and feet of the Savior.
Mm, Thank you. And one of the things I observe is when I travel in Delhi, I stay in Delhi, and this picture of that we survive because they live.
Mm,
The well-off are living in cities because these poor urban support systems are there. We forget that they are our support system, uh, but we don't normally see
mm.
it through that perspective, as you said.
The other thing that I might mention here, Santos, is that um, people in the church will grow old and they need to have the next generation of believers keeping the church alive. And we have an obligation to make that happen by ensuring that our own children, as well as children outside the fold, come to know what it is to live an abundant life.
And thus transform a generation. That is what
Yes.
you are trying to do. By engaging with children, transform one whole generation so that the next generation will break out of the cycle of poverty and have an abundant life. Thank you, Dr. Milton, for sharing that. Um, our time is almost coming to the end. Thank you all for joining. It was an excellent time of listening to Dr. Milton and responding to various questions you all had. God bless you, and we'll see you again next week. Encourage others to join for the upcoming webinars. Thank you once again. See you next week.